All right. So now I'm talking to COVID-19 and headache again today, as I've had a lot of patients with headache and COVID-19. I've had at least three, and there's one old elderly gentleman with an 84-year-old gentleman who had headache and COVID-19, and then we had his MRI, and his MRI, did show bilateral old strokes in it, a bunch of microhemorrhages, which we don't know if it's related or not related to COVID-19. We talked about that in another video where COVID-19 does seem to have a higher correlation with microbleeds, but we don't know what exactly is taking place. The second patient that we've had is uh, a lady with um, headache that just is unrelenting. It won't go away. She doesn't have anosmia, but she just doesn't feel well. And then COVID-19 and headache in this gentleman that we've seen over the last few days. Treatment with prednisone was there. And then the thought process is, are these acting like migraine headaches? And most of the MRIs that we're getting back are all normal or negative. So my thought process is most likely all of this is migraine, but you do worry about that vasculitic process. When I think about headache in a patient, um, I usually think about scanners, and for some reason, it just reminds me of the movie Scanners. And if you haven't seen the movie Scanners, it's a pretty graphic movie. I won't show you the whole thing, but this is one clip from Scanners that I just wanted to talk about. This is this guy, and this is right here. You just go back here, and it's all right. And that is just a migraine headache for you. So right here on headaches, we talk about, if you go to PubMed and you look at a couple of different articles, you can see a series of red flags in patients with COVID-19 and headache. And I really like this article because it talks about headache being just a baseline sign symptom, and then what are the signs that are red flags for these patients. And it's a good article. Um, Let me talk to the part that I really found was interesting is that you have basically you have COVID-19 and headache, which is in this paper, is a review of NSAIDs and corticosteroid use. And so it's sort of the bag is still out for these patients. And they say basically, based on expert opinion, anecdotal evidence publicized to the media, recent concerns were raised that NSAIDs may worsen the symptoms of COVID-19 infection. So you notice that on our patient, Mr. Srinivas, they started, the hospital actually themselves started naproxen, which is an NSAID, on the patient. And this controversy that's going back and forth on NSAIDs during COVID-19 has stemmed from several sources. The concern that NSAIDs as such as ibuprofen might be causing worse clinical outcomes in those infected with COVID-19 became a topic of international discussion following the tweet from France's health minister, Oliver Véran. And so this was based on French physicians' observation of 4 young, healthy individuals who had serious symptoms of COVID-19 in the setting of COVID NSAID use. But this is not really a peer-reviewed article. And so the conclusion is that COVID-19 is constantly evolving, and we need NSAIDs and steroids during the pandemic. But I, ended up using steroids to treat a few patients, and I found that they're actually pretty helpful, but there's no clinical trial that's actually talking to this. And so the question is what is this? What is headache? And they say headache associated with COVID-19, including features resembling migraine and or atypical symptoms. And this is from Dr. Toptan. And it's a really interesting article here in the journal of headache. And this talks to COVID-19 and it actually creating a migraine type symptom or type syndrome. Then, but of course, there are case studies that are out there. If you put in COVID-19 and vasculitis, that's there also. And that I've actually seen. So you have to be, you want to get your MRI, you want to get your CT scan. And then in this, the frequency of type and red flags with patient with COVID-19 and headache, a series of 104 patients with headache. You see the red flags concerning were prior history And the elevated CRP that's noted in 84% of cases. That's really sort of interesting that's there, but that really wasn't exactly what I wanted to talk to. What I really wanted to talk to is this article, I think. And let's see what the actual symptoms are that are associated with this. The possible, we concluded that as a common non-respiratory symptom of COVID-19, headache should not be overlooked, and its characteristics should be looked at with scrutiny. And they talk about this where you have new onset, moderate, severe bilateral headache with pulsating, pressing quality in the temporal parietal region of the forehead or periorbital area. And this is sort of this area that's caused, that's associated with COVID-19. So you'll have this pressing headache on both sides. And that is exactly what our population is describing. But headache that's associated with anosmia, hypogeusia, which means inability to taste, inability to smell, non-respectively, and then the other features such as this throbbing headache, but and then issue with loss of consciousness. These are really, really important things to basically go out and get scanned for. So there's a fine line of all of this. And then in addition to that, especially in a country where COVID-19 is everywhere, you wonder about sending your patient to get reinfected with COVID-19 by going to the CT scan. So it's really an important thing to talk about. It's really, there's no current guidelines on headache and COVID-19 as we speak today, but it will, I'm sure, be coming out, and I'm sure as time goes on, we'll have better definition of, treating with steroids, not treating with steroids, treating with NSAIDs, not treating with NSAIDs. My thought is that before you treat with NSAIDs, especially because this can cause stroke, and especially because that can usually make both ischemic and hemorrhagic stroke worse, you may want to get scans beforehand. But then you also have to take the risk of sending out your patient for a scan in the middle of COVID-19. So those are my quick thoughts.